Let's talk about Esmolol. Okay, so this is an alolol. What does that mean? Do we all remember? This also guy is by Esmolol. Okay, so Esmolol is a class 2 antiarrhythmic. Class 2 antiarrhythmic beta blocker. What do beta blockers do? Well, they block betas, right? So class 2 antiarrhythmic, it is a beta blocker. What is its action? Slows the heart rate through selective blockage of B1 receptors. That's T, not a D. Slows the heart rate through selective blockage of weird looking B1 receptors. So it's an alolol, OLOL, which, if it ends in LOL, OLOL, it is a beta blocker, correct? Correct. So, class 2 antiarrhythmic slows the heart rate through selective blockage of B1 receptors. This particular one has a short half-life. Means once you stop it, it stops fairly quickly. What are our indications for a beta blocker? Tachycardia. We want to slow heart rates. We use the beta blocker to slow our tachycardias. This particular drug is one that I have not had much, if any, experience with, so I can't tell you a whole lot about it other than what I'm telling you on the card and what I know about alolols and being beta blockers and what beta blockers do. They block betas and slow the heart down. So our dosage on this is going to be 50 to 100 micrograms, mcg, micrograms per kilogram per minute. So we've got a dosage calculation to do. It's micrograms per kilogram per minute. So the only way you can give this is IV. Okay, so this is an IV medication. So our contraindications for our beta blocker: asthma, bradycardia, so we don't want to slow down what's already too slow, heart block, again, we're slowing the heart rate through selective blockage of B1 receptors. So we're slowing the heart rate down. We don't want to slow the heart rate down with our heart blocks. We're not going to give this to an asthmatic or a bradycardic patient either. The other is cardiogenic shock. Why don't we want to give this to a patient in cardiogenic shock? Because we're slowing down the heart rate. What's going to happen when you slow down the heart rate? Your blood pressure is going to drop. So if you're already bradycardic or you're already hypotensive, we don't want to make that worse, and that's exactly what's going to happen. So that leads us to our adverse effects, which this is an effect. This is not necessarily an adverse effect. If you're giving Esmolol or giving a beta blocker, you can expect bradycardia. You can expect to see a slowing of the heart rate and possibly below 60 beats per minute. So, effects, bradycardia. Hypotension. Congestive heart failure. And lethargy. They're going to be tired, they're going to be sleepy, they're going to be lethargic. Or can be. I guess I shouldn't say will be, they can be. So while we're thinking about this, okay, so another contraindication would be calcium channel blockers or IV calcium channel blockers. So if you're already on, if your patient is already in the hospital and they're already on a blocker to control blood pressure, control heart rate, whatever reason, and you're on a calcium channel blocker or a beta blocker or for blood pressure or heart rate, why would you want to give the opposite one again on top of that? So you're either going to stop the calcium channel blockers, hopefully let the effects wear off, and then start your beta blocker, or the other way around, whichever the case may be. But you don't want these two working together, because probably bad things are going to happen, most likely. So we're going to see hypotension, but it's dose related. So if you're at 75 mics per kilogram per minute and they're hypotensive, slow down your rate to 25 or I'm sorry, not 25, but 50 or 60. Slow it down, titrate it to the effect that you need it to be. Of course, I don't know a service that carries Esmolol, so this is probably going to be more of a hospital or an interfacility transfer thing. So of course, always relate back to either your standing orders, the doctor's orders, or your med control before you do any changing. But if they're on this and they're hypotensive, chances are that you can either reduce the dosage just enough to get the effect that you want while maintaining the blood pressure, or you check with your med control to see if you can do what they want you to do. Okay?